Hi, I'm Dr. Taha with Florida Cancer Specialists, serving as the Medical Oncology Director with Delray Medical Center. Today we're going to be discussing and understanding it's Colorectal Awareness Month in March. And we're here to talk about understanding colorectal cancer. We're going to dive into the basics and talk about the importance of screening programs, prevention, techniques, and I'll even give you some background about colorectal carcinoma. So let's talk about understanding colorectal carcinoma. In the United States, colorectal cancer is the third most common cancer in both males and females. Yet it is one of the most preventable types of cancer. That is why screening is so imperative for our patients. We understand there's a global pandemic occurring right now. We understand many patients are fearful in going to get screened. But I must implore that it is so important that screening measures are taken so that the earlier you catch any disease process that may be occurring, the better your outcome you may have with your unfortunate ailment. Regular screening for and removal of growths in the colon called polyps reduces the risk of developing colorectal cancer by up to 90% with a simple screening colonoscopy. What common cancers can you prevent with screening? Well, let's go into it. Prostate cancer, despite all efforts, it's important but there aren't really any good prostate cancer screening methods per se that you yourself can prevent the cancer. Breast cancer is the same, absolutely. You should get your mammograms conducted. But without a doubt, colorectal cancer is the one that you can actually prevent by being on top of your own personal case, and this is commonly detected through a simple colonoscopy. So not only why is screening important for colorectal cancer? Because early detection is key. You can prevent, not just detect colorectal cancer with a screening test called a screening colonoscopy. This is usually conducted by a gastroenterologist, a stomach doctor. They remove precancerous growths in the colon. They're called polyps. You may often hear that from your physicians. There's many different types of polyps. Some are simple polyps, others are precancerous polyps, and those are the ones that need more attention. By removing these polyps, you can actually reduce the risk of cancerous colorectal growth. Screening by colonoscopy with polyp removal prevents colorectal cancer before it even starts. The power is in prevention and early detection. So in this slide, I have a nice diagram of what the colon actually looks like. I mean, you always wondered, hey, what is he looking at? Where is he going? Why are they doing this? And here in this slide, you'll see the different areas of the large bowel and large intestine. You have anywhere from in the appendix all the way down to the rectum. So it goes from the cecum to the ileum, up the ascending colon to the transverse colon, down the descending colon through the sigmoid colon and out the rectum. And this is what your gastroenterologists and your physicians are looking at when they are looking for polyps within that colon. Oftentimes, I get asked by patients, well, doc, why can't we see that on a CAT scan? Or just do a simple CAT scan, because we recognize this is not a comfortable screening test to do quite often. And the reason why is the best way of detecting these polyps is through a colonoscopy and not through a CAT scan. So according to physicians from the American College of Gastroenterology, screening by colonoscopy and polyp removal prevents colorectal cancer before it can start. Well, where does colorectal cancer start? It usually starts as a benign growth that we talked about already, which is a polyp. So what's a polyp per se? It arises from the innermost layer of the colon, which is called mucosa. If the cells spread into the first layer below the mucosa, this is then called the submucosa, and that's where the cancer is typically present. So by removing this polyp, you're able to analyze the polyp in detail to look for either cancerous cells, precancerous cells, or a benign polyp itself. So let's talk about colon polyps and what they are. A polyp is a small clump of cells on the lining of the colon. Most colon polyps are harmless, but at the same time, some colon polyps can develop into colorectal cancer. often fatal when found in its later stage. Now, why is this a problem? We're in a global pandemic, and many patients, unfortunately, are fearful of having their routine surveillance scans done. Now, the challenge is if you're not getting your routine surveillance scans conducted, then we unfortunately detect cancers when you do decide to have the scans done, or treatments done, or screening tests done at later stages. And early detection is so key. It is so key in order to fight this cancer and hopefully achieve a cure. And so not all polyps turn into cancer, but all cancers start as polyps. So by catching the polyps early, you're able to resect these polyps out and hopefully not have a disease process occur. Because colon polyps do not usually cause symptoms, it is important to have your regular colorectal screenings conducted like a simple colonoscopy early. Remember, screening by colonoscopy with polyp removal prevents colorectal cancer before it even starts. So in this slide, we're going to talk about polyps. These are examples of how it looks like. This is what a gastroenterologist would see when performing a screening colonoscopy. And you see in these slides that these are abnormal mucosa polyps that are present when looking at a colonoscopy. And these are essentially what a gastroenterologist physician is looking at when he's conducting these procedures. Some of these polyps, as you can see in this slide, are really challenging to see. These are very challenging to detect as a gastroenterologist. That is why it is important as a clinician that we really be thorough with our examination and detect these possible precancerous or cancerous lesions to help our patients. Physicians from the American College of Gastroenterology want you to know that screening tests can find precancerous colon polyps so they can be removed before they turn into colorectal cancer. Colonoscopy is the only screening test that allows both identification and removal of the polyp. This procedure is called a polypectomy. It's a powerful cancer prevention tool that we utilize. Removal of polyps prevents up to 90% of the colorectal cancers, and with appropriate follow-up, the chance of death from colorectal cancer is significantly reduced. Early detection, again, is key. This is a slide which essentially is what the gastroenterologist is looking at. What you see is the camera going up the colon and going through the ascending colon, and this is your physician looking for suspicious polyps to perform that polypectomy, removal of the polyp. This is essentially what it looks like when he's performing that procedure. And you can see subtle abnormalities and, of course, gross abnormalities that are seen when he's looking through his scope. So who is at a risk for colorectal cancer? I want you to know that 1 in 23 men during their lifetime are at a risk for colorectal cancer at some point. 1 in 25 females are at a lifetime risk of colorectal cancer at some point. It affects both males and females. In 1990, estimates show that people born around 1990 have twice the risk of colon cancer and 4 times the risk of rectal cancer than those born around 1950. While the reason for these trends are complex, experts suggest unhealthy diet and sedentary lifestyles may contribute. And so though we are getting better with detection, though we are getting smarter with our technology, this is becoming more of a challenge and more of a problem due to 1, lack of activity, and I will talk about it more in detail, and 2, our lifestyle, the way that we behave, our external factors that we incorporate into our daily routines within life. They make it challenging from a health standpoint that may hurt us one day. So here are some factors that may increase your risk for colorectal carcinoma, including family history of colorectal carcinoma, family history of adenomas, cigarette smoking, obesity, gallbladder removal, physical inactivity, abdominal prior radiation, cancer of the uterus or ovaries before the age of 50, a history of ulcerative colitis or Crohn's colitis, and African American race also increases your risk. What are symptoms and signs of colorectal cancer? Well, most early colorectal cancers produce absolutely no symptoms. That is why it's so important to have these screening colonoscopies conducted. Never ignore new or worrying symptoms. I tell patients all the time, no one understands your body and your symptoms better than yourself. Not your spouse, not your parents, not your physician, but yourself. Reach out to your healthcare provider if you have any symptoms, regardless of age. There are patients that I have that unfortunately are diagnosed before these screening recommendations. So pay attention to those signs your body is giving you and do something about it and reach out to your local clinical provider. Should you wait until you get symptoms to be checked for colorectal cancer? And the answer is absolutely not. Do not hesitate to talk to your healthcare team about symptoms, even those that seem hard to discuss or share, including, I know they're uncomfortable, but as clinicians, we're actually pretty used to it. Discussions about blood in the stool, or change in bowel habits, or change in the shape and size of your stool, rectal pain, abdominal pain, unintentional weight loss, unexplained or new anemia. Those are all things we are quite commonly familiar with that we hear all the time, and we do want you to come to us when you do have these symptoms. What should you do if you don't have any symptoms of colorectal cancer? The answer is get screened. Screening means getting checked even when you don't have symptoms. And once you get screened, you put that, and God willing, everything's okay. You get a check mark and you put it behind you and you're done. You're done for a period of 5 to 10 years, depending on what they find. So let's talk about different screening options that have come about for colorectal cancer. There's one-step screening versus two-step screening for colorectal cancer. This was just passed by the American College of Gastroenterology in 2021. They presented new guidelines on colorectal cancer screening, explaining the differences between the recommended one-step program of testing and two-step program of testing. In many instances, the best screening test is the one that gets done. I get asked all the time, should I get the one-step? Should I get the two-step? It matters that you just get it done. And there's not one that is clearly better than the other. So let's go over the one-step screening test. That is the colonoscopy, what I've gone into in detail. It's the one-step test that looks for growth called polyps in your entire colon, the large intestine, and rectum using a colonoscope. Your doctor can both detect and remove polyps during colonoscopy and prevent colorectal cancer during the procedure we just talked about by performing a polypectomy, removal of the polyps. Colonoscopy is the most commonly performed gastrointestinal procedure in the United States. With removal of polyps, colonoscopy offers long-term protection against developing colorectal cancer or dying from it. Now let's talk about the two-step screening test. That's stool-based test. There's multiple types, but this is a test to detect blood or altered DNA in the stool as the first step, and then if there's a positive result, that would lead you to the second step of colonoscopy for further examination. And this month, we at Delray Medical Center are actually giving these, what we call FIT tests, away to patients if they inquire and ask for it. And we implore you to try, and we will provide that information for you so that you can contact us for more details. So the name of the first test is called the FIT test, which stands for Fecal Immunochemical Tests. This detects hidden blood in the stool. The stool FIT test is typically performed on an annual basis. A positive test tells us, hey, you need further evaluation. You should get a follow-up colonoscopy. You also have a multi-target stool DNA, also known as MTS DNA. It's a non-invasive screening that looks for abnormal DNA associated with colon cancer or precancerous polyps. It is more sensitive than FIT test, meaning it detects better than a typical FIT test, but your chance of getting a false positive may increase with advanced age. And what that means is your chances of getting a positive result that truly isn't a positive result unfortunately increases with age. If the MTS DNA test is negative, a repeat screening occurs in 3 years. If the MTSA DNA test is positive, the second step of colonoscopy is required. And at that time, the only FDA-approved MTS DNA is called Cologuard. Now let's talk about tests that are available for some patients who cannot or will not have a colonoscopy or a FIT test. These are patients who are not candidates for colonoscopy. There's a test called a CT colonography and colon capsule. At this time, CT colonographies and colon capsules are options for individuals unwilling or unable to undergo colonoscopy or FIT tests, provided that the tests are locally available and reimbursed by insurers for screening. It's important to note that both tests will still require a full follow-up colonoscopy if positive. So again, let's compare one-step test for two-step tests. The one-step test is the colonoscopy. Your doctor will go in, he can see and remove precancerous polyps and preventer detectors or confirm colorectal cancer all in one step. The two-step test is, the first step is a stool-based test, which is called a FIT test, a fecal immunochemical test. And what that looks for is blood in the stool. If that sees blood in the stool, then you need either a flex sigmoidoscopy or a CT, a screening colonoscopy at that time. And at that time, a polypectomy would be performed if abnormal features were seen, and those would be analyzed for colon cancer at that time. So let's talk about screening recommendations from the American College of Gastroenterology. We recommend colorectal cancer screening in average risk individuals between the ages of 45 and 75 years to reduce precancerous growths called adenomas, or reduce colorectal cancer and reduce death from colorectal cancer. We suggest that the decision to continue screening go on beyond the age of 75. We recommend colonoscopy and FIT tests as primary methods for colorectal screening. We suggest considering the following screening tests for individuals unwilling or unable to undergo a colonoscopy or FIT tests. Those include a flexible sigmoidoscopy, multi-targeted stool tests, CT colonographies, or colon capsules. We recommend the following tests as the primary screening methods for patients at average risk for colorectal cancer on this schedule. A colonoscopy should be performed at least every 10 years. A FIT test should be performed every year. If one of these alternatives is used, then it is recommended that the test be done on this schedule. Multi-targeted stool DNA test every 3 years, a flexible sigmoidoscopy every 5 to 10 years, a CT colonography every 5 years, a colon capsule conducted every 5 years. Screening for African Americans is an important topic I often discuss in detail. African Americans are diagnosed with colorectal cancer at a younger age than most other ethnic and racial groups. African Americans with colorectal cancer have decreased survival compared to those with other ethnic and racial groups, which is why the ACG guidelines recommend colorectal screening in African Americans starting at the age of 45. Now, if some patients have a primary family history younger than 45, the rule of thumb is 10 years before the primary diagnosis. So if you have a family member that was diagnosed with colon cancer at the age of 48, then the recommendations is you start your screening at 38. So now I want to talk about screening for patients with family history of colorectal cancer or polyps. And we briefly alluded to it in our discussion previously. But for individuals with a family history of colorectal cancer, you may need to talk with your healthcare provider to see if you need a colonoscopy either more frequently or earlier. Sometimes genetic testing is required to determine your risk of colon cancer if you have a strongly family history, especially with younger age of affected relatives. There are hereditary syndromes that affect colon cancer specifically that you may be, unfortunately, have that type of mutation in your DNA. So getting a screening test scheduled, how do you arrange a colorectal screening? After you listen to our discussion, you're motivated and would like to get one started to get screened for colorectal cancer. The way to go about it is to ask your doctor to refer you to a gastroenterologist. The gastroenterologist is a stomach doctor that is a specialist in diseases of the digestive system and the performance of a screening colonoscopy. Take control of your health. You want to get screened. Make a plan to talk to your healthcare provider about colorectal screening and getting checked. Don't put off preventive healthcare screenings. Most importantly, remember to get screened. There's no excuses. Get screened for colorectal cancer. It is, for the most part, a preventable cancer when screened appropriately. And your excuse to avoid colonoscopy, I feel fine, as this slide depicts. Colon polyps and early colon cancer can develop silently without symptoms. Waiting until symptoms occur can mean the cancer is more advanced and less likely to be curable. Another excuse we typically hear with reasons to avoid colonoscopies: I'm healthy, why would I get screened? Well, according to experts from the American College of Gastroenterology, colorectal cancer screening is for healthy people. If we find a polyp, we remove it and prevent it from becoming a colorectal cancer so you don't have any challenges with your future or your life. Another excuse that we typically hear: no one in my family had colon cancer, so why do I need it? Don't be the first. Roughly 5 in 100 people are destined to get colorectal cancer in their lifetime, even without a family history. Another excuse that we hear is, I have no risk factors, doctor. I don't think I need a colonoscopy. Well, the single biggest modifiable risk factor for colorectal cancer is failure to be screened. Only men get colon cancer is another excuse we often hear. Colon cancer, unfortunately, is an equal opportunity disease. Women have pretty much the same risk as males at obtaining this unfortunate cancer. With Colorectal Awareness Month here in March, if you're interested in a FIT screening test kit that is free, please call 1-866-631-2265. If you're interested in being seen by a provider or learning more information, you can reach us at flcancer.com, delraymedicalctr.com, or you can call my office at 561-808-0098, and we will personally take care of you.